We're going to be talking about sinus infections today. Dr. Sennett, thank you for sitting with me.
Oh, my pleasure.
So I understand that sinus infections have been running rapid around eMedical urgent care lately. What exactly are sinuses?
Sinuses are cavities or hollow areas that you find in the face. There's the frontal, there's the maxillary, there's the ethmoid, which you find over here, and the sphenoid are right behind the eyes. That's just when you have pressure behind your eyes from infection, it's usually those back there.
Okay. Now, what exactly is sinusitis or a sinus infection?
Itis in general means in Latin inflammation. So by adding itis to sinus, it tells me that you have an inflammation or an infection of the sinuses. This is basically the inside of the sinus is swelling and inflamed, and it can be very, very tender. The sinuses are normally just filled with air. It's part of the whole filtering process. But when they become blocked or filled with fluid, which often happens with sinusitis and during the allergy season, bacteria can begin to grow in the mucus that's collecting as it sort of festers in there and can cause a pretty painful infection.
How common are sinus infections?
This season, I would say extremely common. More than 37 million Americans actually suffer from at least one sinus infection a year. It's increased during recent years, particularly I've noticed this year, both spring, summer, and fall, and now into the winter. This probably is due to the increased pollution that we're putting out into the air, as well as continued resistance to antibiotics from over-prescribing.
What are the signs of a sinus infection?
They're hard to miss. Often it's pain in the face. Sometimes it radiates to the ear. Patients will often come in complaining of an ear pain, but it's actually from the sinuses. The same facial nerve that gives the feeling to the ear actually is from the sinuses. This way, and this way. Someone with a sinus infection, particularly in the maxillary sinuses, they feel like they have a toothache because the roof of the mouth is actually the floor of the sinus. As I alluded to before, the frontal sinuses or the sphenoid will also give you pressure behind your eye, almost like you feel like your eyeball is pulling out. So it's treated exactly the same way when you take a look inside.
Can having a sinus infection throw off your equilibrium, or would you get off balance?
Yes, you very much can. You can have what they call vertigo, which is a spinning kind of sensation, or just feel like you're rocking on a boat.
How would you treat a sinus infection?
There are a couple ways to treat it. Most of all, we will prescribe antibiotics. A true sinus infection is a long-term antibiotic type treatment. You're going to, it's not a quick 5 days or 7 days. It often can be 2 to 3 weeks to treat a true sinus infection. The other thing you want to do is, the image I always tell my patients is, you want your nose to run. You want anything that's hot or steamy or makes your nose run, like mustard or wasabi, to get it out. The more that it festers or thickens in the sinuses, the mucus, the more the infection, the more pain, the more pressure. So a hot shower, as I said, hot drinks, anything that makes a good cry, you know, a good like The Notebook, like
yeah. Just watch one sad movie and your sinus infection
opens up. Yeah, it helps. Well, it helps clear it out. The idea is to clear it out. You don't want to take anything that's going to make it thick. Mucus can also thicken with like dairy products. So I try to tell my patients during the treatment to try to avoid as much dairy as possible because that'll also thicken it. So the image is to get it draining. The other thing you can use is a neti pot. Often people use that with the liquid to help irrigate. Normal saline will also help. Anything to clean them out is a big help.
I've read things in the news though about neti pots. Is there any precautions that should be taken before doing any drainage?
Well, you want to make sure it's not hot.
Yeah.
The last thing you want to do is burn yourself. That'd be extremely painful as well. And you want to make sure that they're clean. You also don't want to put in any water that's been stagnant or sitting around to induce another infection in there.
Now, are sinus infections often treated with an antibiotic, or should the over-the-counter medications work?
A true sinus infection where there is an infection inside and not just inflammation needs an antibiotic. It won't clear up otherwise. I usually recommend decongestants. That'll help relieve the pressure, particularly in the ear, as well as in the sinuses themselves. Often, if the inside of the nose, or the turbinates, so we call it, are swollen, we'll recommend either a nasal decongestant for a short period of time or a nasal steroid like Flonase, Nasonex, or that type of a brand. Again, to help open up, bring down the swelling, and facilitate drainage. That's really key.
Would a humidifier help also, or probably not?
No, a humidifier, cool mist. would also help. When people have dry air, like in the winter times when we have the hot air blowing, it'll often exacerbate or make the symptoms worse, causing more sinus infections. So yes, a humidifier would be a great choice.
Are sinus infections contagious or?
No, thank goodness. They're well contained within the sinuses. So as an ear infections and sinus infections are not contagious. Untreated, if you have a lot of postnasal drip, those sinus infections can often lead to an upper respiratory type infection or bronchitis. It's not uncommon. So again, it's important to treat.
Can travel exacerbate or make the symptoms worse of a sinus infection?
Definitely. The pressure and depressurization of the cabin of the plane will increase with the pressure in your face, the sinuses, as well as your ear and your station tube. So sometimes flying in general can make the sinus infection worse and also lead to an ear infection. So it's very important, especially if you're traveling. We're here to take care of you if you're visiting family and friends.
Okay, perfect. What happens if a sinus infection is left undiagnosed, though, or untreated?
A true sinus infection left untreated can actually cause an infection around the eyes or the orbital type area. It can also lead to infections into the teeth, and severe cases could lead to like meningitis or encephalitis.
If I have symptoms of a sinus infection, is it best to get it treated right away or just wait a few days to see if it'll clear up on its own?
If you have a fever, if the mucus coming out is thick or green, or if you have extreme pressure or pain, then I would probably come more immediately. If it's a clear drainage with a little bit of pressure, you might want to give it 24 hours, maybe with the decongestant, to see if it's just a cold that's causing the inflammation of the sinuses that could pass. But if there's any question, like I said, of fever, increased pain, blood, or thickening, then we need to see it right away because you need to be on a box and we want to treat that.
Could a sinus infection lead to like a migraine type of headache or sensitivity to light?
Yeah, as well as dizziness. Sinus infections can lead to really severe headaches and to the point where you can't tolerate light or even noise. And it can often mimic a migraine. Difference being is where the pain would be located, and again, it'd be right in that area.
Okay, well, thank you so much for talking with me today. This has all been really helpful.